Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman, Dr. Gil Lederman with the Radiosurgery Hour. We're here live at the WABC studios. We have lots to talk about today, so we're going to move on directly. If you have questions, you're welcome to call us. We're at 1-800-848-9222, 1-800-848-9222. Please call if you have a question. The first patient I want to talk about, this man is a businessman. He owns a fruit and vegetable business, so he's in the wholesale business, delivering tons of fruit to grocery stores and other places. Last year I saw him, his PSA was 2, and he came to me wondering if he should have a biopsy, and I said, well, your PSA is low. I don't see any reason for it. This year he came to me, his PSA had jumped from 2 to 3.5, so it actually increased almost by 50%. And I did recommend a biopsy for a couple reasons, number one of which is the PSA had jumped. And number two, there's more and more studies that show that watchful waiting for men with prostate cancer is a lousy option. There's a randomized study that shows that men that have prostate cancer and don't get treated have higher death rates and lower survival than men that get treated. There's studies that show that in areas of the country where people get screened more and treated more, the survival is higher and the death rate is lower. So based upon data, which is what we love to do, data, I recommended a biopsy, and he came in yesterday with his daughter and now has a Gleason 7 cancer. He's about a 55-year-old man, beautiful wife, lovely daughter, and of course he wants to live. Now, he's been seen by 2 urologists. A urologist is a surgeon who does the biopsy and who recommends treatment. And in this case, of course, they recommended radical surgery. Well, it's easy to see why. They're surgeons. If you have a hammer, the world looks like nails. They both recommended surgery. And then he came to me and wanted to know what I thought. And we opened up our booklet. There's a free booklet DVD that I send out to people, and you can see in multiple pages, the best surgeon in America. I'm not talking about the surgeon this guy went to, the best surgeon who recently retired for Gleason 7 has about a 66% chance of success 5 years later, and at 10 years, 46%. I said to the man, are you going to be happy with a 46% chance of success for Gleason 7 with surgery in good hands? And you're not even in these hands. You're only 55 years old, 56 years old. It doesn't make sense when you can come here and our success rate is 90% for Gleason 7 cancer. And it's all in the book. I think we're the only place that publishes our data and comparison data. And, of course, why do we do it? We do it because we want the patient to be informed. We think you deserve to be informed, number one. Number two, we're proud of our data. It's a program that's been going on for more than 20 years. It's withstood the test of time. We have patients out many, many years. So for this man, he can choose to have radical surgery with a 10 years, 46% chance of success, with most men having a negative, a bad impact on urinary life or sexual life with open surgery, or he can avoid surgery and come to us. So where would you want to be? 90% with us, being treated in the stereotactic frame and brachytherapy, or 60% with surgery and the complications of surgery. So to me, it's an easy choice. His daughter was crying because I guess she felt sad for her father having to choose and having this conflict with surgeons who said, the best treatment surgery, but they didn't give any data. And here, data very clear in black and white, showing where the best results are based on thousands of men we've treated. So if you have questions, let me know. If you have prostate issues, let me know. If you want the booklet DVD, let us know. Again, our office number is 212-CHOICES, and we'll be happy to send you that booklet at no charge. And interestingly, this week we saw another patient. A man walked in my office that I treated 15 years ago for prostate cancer. He's now 87 years old, and wow, what a story. So he walked in the door. I haven't seen him. He hasn't shown up in years. And he walks in, 87 years old, spry, looks about 70 or 68, and is an Irish heritage. And he comes in with this immense cancer of the skin over the left forehead and cheek and ear. He had gone to big surgeons at a big hospital in Manhattan, and they were going to cut off his face, his ear, his forehead, and replace it with grafts and flaps and surgery and And these two surgeons were pushing him. They were pushing him, and finally he agreed to have this big surgery. He never sought other opinions or got other options. He got to this big hospital, and finally the anesthesiologist nixed the operation. They thought cutting off the ear and the face in an 87-year-old man was just too much. And he came back to see me. I treated him 15 years ago for prostate cancer. He was a high-risk prostate cancer 15 years ago. He had a PSA 14. We treated him in the stereotactic frame then, brachytherapy, just like I talked about a minute ago with this other patient, Gleason 7. And he's been in complete remission for 15 years, no other treatment. He had the course of treatment, a short course of treatment with us 15 years ago for prostate cancer, and he's happy about it. And he remembered finally that there are options, came in, we evaluated the skin cancer, which was very extensive. It involves the ear, the forehead. We talked about the risk benefits alternatives. Most likely we can successfully help him non-invasively without cutting off his face or his ear or his forehead. And he was hot to proceed. He took a day, went home, thought about it, and called me up that he wants to get going. But what's even more interesting is every patient that comes in, I talk to the patients. I meet the patients. Usually I spend an hour with the patients. And he said to me in passing, when I asked him about his kidneys and his lungs, "Oh, by the way, Doc, I have a tumor in the lung and a tumor in the kidney, but my doctors tell me it's been stable for a year." I said, "You have a cancer in the kidney and the lung that's been stable for a year?" He said, "Yeah, that's what my doctors tell me." And I said, "Well, do you have any reports?" He said, "No." Has anyone compared the reports from last year to this year? He said, "No." But he had them, and he had the test done. And I called up the radiologist, put him on speakerphone. The patient heard the conversation. The doctor, who was the chief of radiology, reviewed the scans of the kidney, the scans of the chest. And yes, the patient was right. He did have a cancer of the kidney and a cancer in the lung. But he was wrong. He wasn't wrong. His doctors were wrong. His doctors had told him everything was okay, when in fact the cancer had increased in diameter by about 10%, which in volume translates to about a 30% increase in volume of these cancers in the kidney and the lung. So, wow. Yes, we treated him for prostate cancer 15 years ago. He comes in now to try to have his face saved from the surgeons who wanted to cut off his ear and face. And then I find out that he has a kidney cancer spread to the lung, and his doctors were telling him everything was okay when, in fact, it was growing 30%. So in reality, I believe this man should have the radiation of the face, most likely will be successful. He should also have the radiosurgery for the kidney and the lung. My son just evaluated the data for kidney cancer metastatic to lung. We've treated many, many patients over almost 20 years. We were the first in America with body radiosurgery. Kidney cancer, we've treated many. Our success rate for kidney cancer metastatic to the lung to stop, shrink, or make that cancer go away is 94%. Yeah, 94%. Non-invasive treatment, no cutting, no bleeding. So this man, he's had benefit from our services in the past. He's still in remission from the prostate cancer. Now, unfortunately, he has very fair skin, a lot of sun exposure, Irish heritage. He has a very extensive cancer in the face, and we're very good at treating skin cancers, I might add. And then, incidentally, we found out through him, and he asked me yesterday on the phone, "How do you know about my kidney cancer in the lung?" I said, "Well, you told me." And furthermore, I would have called for all the records, because that's what we do, and found it as well. So prostate cancer remission, skin cancer going ahead, kidney cancer with lung metastasis. He's contemplating whether he should be treated, if you can believe that, while the cancer has grown 30% in 1 year. So interesting man, interesting story, interesting case. Wow. The truth is stranger than fiction sometimes. We're going to take a break. We're going to hear from some new voices about radiosurgery. We're at the WABC studios. We're live. Our number is 800-848-9222. We always get a lot of callers at the end of the hour, so if you call, you probably will have more time earlier on. We're going to go to our sponsor, but first, listen to that number again, 800-848-9222. This is Dr. Lederman from Radiosurgery New York, talking about ways to improve your health, improve your medical care, improve your cancer care. We're a cancer treatment center.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman